The hard truth about heartworm disease in cats is it is hard to understand, hard to diagnose, and hard to treat. Well, that's because there is no treatment. It is hard to believe. Some people don't think cats can get heartworm disease, which is hardly the case. Because of this, it is not hard to understand why heartworm disease is underdiagnosed in cats. It is also not hard to understand why I keep saying hard. That's the disease a heartworm causes in a cat. Heartworm-associated respiratory disease, or HARD. Hi everyone, I am Dr. Oz. In this video, I'm going to chat about heartworm disease in cats. Yes, cats can get it. Wherever heartworm exists in a dog, cats are also at risk. And that risk is increasing with climate change and the movement of animals, namely dogs, around the country and world. The rules are changing as we learn more about heartworm disease in cats, which occurs in all 50 states and worldwide. In this video, I'll chat about how cats get heartworm, how we diagnose it, what a heartworm does in a cat. Spoiler alert, a heartworm does not want to be in a cat, and the current recommendations on prevention. If you have a dog, hopefully on heartworm prevention, you're probably familiar with testing and prevention recommendations. You know heartworms can be found in the heart of a dog, and maybe you know a little bit about treatment of heartworm in dogs. So if you know a little bit about heartworm in dogs, you'll be happy to know very little of it applies to cats. Like I said, heartworm disease in cats is hard. But in cats, it's all about the lungs. How do cats get heartworm? Just to be clear, a heartworm infection in a cat is defined as the presence of an adult worm or worms within the lung blood vessels or a heartworm larva migrating in tissues. HARD, or heartworm-associated respiratory disease in a cat, is the disease within the body that is caused by a current or past heartworm infection. Nationwide, the prevalence is about 0.55%, or 1 in 200 cats test positive for heartworm. On the surface, that doesn't sound too bad, especially when compared to dogs. But a few things to note. We are definitely not testing as many cats as we are dogs, and because of that, we do not have nearly as much data on cats as we do dogs. As a cat vet, I blame many things on dogs, and heartworm is one of them. For a cat to be infected with a heartworm, it needs to be bitten by an infected mosquito. And for a heartworm larva to end up in a mosquito, it probably bit an infected dog. That's why the heartworm maps for cats look so similar to the heartworm maps for dogs. A heartworm typically goes from an infected dog into a mosquito that then bites a cat. If the same heartworm rules that apply to a dog were also true for a cat, we'd be saying you could find juvenile adults in the pulmonary arteries and heart 70 days after an infected mosquito bites a cat. But the cat reality is, most larvae and immature adults die before maturing to an adult heartworm. The bad thing about heartworm death in a cat is that when it does occur, the body notices and typically responds with inflammation. And a common spot for juvenile adults to die is the pulmonary arteries, where they would have matured into an adult heartworm before entering the heart. Since we have inflammation in the lung blood vessels, now it is not hard to understand why heartworm causes heartworm-associated respiratory disease in cats, and why heartworm is a lung disease in cats, not a heart disease. And I promise that is my last hard reference. Rarely, some juvenile adults can develop into mature adults and set up shop in the pulmonary arteries. When compared with dogs, the worm burdens are generally lower, like 1 to 3. The worms are smaller. They can only be one gender. We'll get to why that's important in a few minutes. And we think they live 2 to 4 years. And since a heartworm does not want to be in a cat, it does weird things and it goes weird places, being found in odd locations like the brain and spinal cord of cats. Heartworm symptoms in cats. The most common symptom of a heartworm infection in a cat is nothing at all. But just like that, out of the blue, they can start showing symptoms at any time. Round 1. You can imagine what symptoms might occur when an adult heartworm arrives at the pulmonary arteries and dies. The inflammation that occurs can result in symptoms like coughing, difficulty breathing, and wheezing. And if those sound a lot like asthma, you'd be correct. And that inflammation, it doesn't just go away when the heartworm infection is cleared, it can stay. Some less common symptoms you may notice are lethargy, not eating, vomiting, and weight loss. But these symptoms are typically seen in any cat that is not feeling well and can occur with any cat disease. Round 2. If, and this is a big if, the immature worms mature to adults and set up shop in the pulmonary arteries, they can actually suppress the immune system. At this stage, you may notice less symptoms because the immune system is not reacting as much to the live adult heartworms. Essentially, a cat is tolerating adult heartworms. They may appear to get better even though now they have live, adult, mature heartworms living in the pulmonary arteries. Waxing and waning of signs. Where have I seen that before? Oh, I know, every cat disease. At this point in a dog, the adults mate and microfilaria or heartworm babies can now be seen in the blood. This can happen in a cat, but it is extremely rare. And when this does happen, there aren't many microfilaria swimming around in the blood and they don't last very long. And this is one of the reasons why diagnosing heartworm in a cat is so challenging. If a mature adult heartworm dies, we will have a second round of symptoms. And unfortunately, one of those symptoms can be sudden death because a dead heartworm can serve as a clot in a blood vessel. Rarely, a heartworm may extend into the right side of the heart, interfere with the function of the tricuspid valve, which results in blood not flowing the way it should in the heart, and that can be heard as a murmur by your vet. Round 3. If a cat survives the death of an adult heartworm, the changes that occur in the lungs can be permanent, resulting in long-lasting respiratory issues. And symptoms that can occur may be difficulty or labored breathing, fast breathing, or intermittent coughing. Diagnosing heartworm in cats. Currently, recommended diagnostic tests include the heat-treated antigen test, antibody test from HESCA or Antec, radiographs or x-rays, and ultrasound. I don't think heartworm occurs as frequently in cats as it does in dogs. And while this is probably true, there is a chance we're just not recognizing it in cats, or we're mistaking it for something else. And I'd argue we just don't think about heartworm in cats because most of our cats are indoor only. Heartworm tests in cats are not that great. There is not a single test that will diagnose heartworm in every cat. Because of this, the recommendations for heartworm testing in cats have changed since the end of 2024. With the acknowledgement of the limitations of heartworm testing in cats and working with what we have, the American Heartworm Society and the Companion Animal Parasite Council, or CAPC, strongly recommends testing cats for heartworm every year with at least 2 tests. One should not rely on a single heartworm test in a cat. A big difference from dog testing is that hardly any cats have microfilaria or heartworm babies swimming around in the blood, so looking for them as you would in a dog is typically not done. And despite being extremely rare, if you find one, you have your answer. The first test is a heat-treated antigen test. The heat treatment applied to the sample can help find heartworm antigen sooner than the typical 7 to 8 months after an infection. And a positive test means your cat has an adult female heartworm or it died recently. Again, there are some limitations to this test. You might have noticed I said female. The antigen we are looking for is only from a female adult worm. So, if your cat has adult male worms, and about 1/3 of cats with heartworm only have adult male worms, we can't see them with this test and a false negative result will occur. Also, I said adult, as in a 7 to 8 month old adult, which means we can't see an immature female worm with this test, unless it is heat treated. Because of this, a negative antigen test does not rule out a heartworm infection. The second test is a heartworm antibody test, specifically the HESCA or Antec antibody test. If your cat has a positive antibody test, that means it was previously infected with a heartworm. It can detect both male and female heartworm larvae 2 months after an infection. There are some limitations to this test. Number 1, different antibody tests can give different results, which is why the HESCA or Antec antibody test is recommended, as it appears it does a better job at detecting antibodies. Number 2, many cats infected with a larva from a mosquito bite will be antibody positive despite the larva never making it to the immature adult or adult stage. Number 3, some cats with an adult heartworm, typically confirmed with a necropsy, have a negative antibody test. Super frustrating. Number 4, a negative test does not rule out a heartworm infection. Number 5, a positive heartworm test does not mean a current infection, just a previous exposure. But there could be a current infection. And number 6, a positive heartworm antibody test in a cat with respiratory symptoms does not mean a heartworm is causing the respiratory symptoms. See why diagnosing and understanding heartworm disease in cats is so... I said I wasn't going to say it again. One thing to note, when we are heat treating a sample looking for an adult female antigen, that heat treatment can destroy any antibodies that are in the sample. So a heat treatment sample cannot be used for the antibody test. Otherwise, you may have a false negative result. As you can see, even with using these two tests, some cats with heartworm will fall through the cracks and a heartworm diagnosis will be missed. That is one of the reasons why it is recommended to test each cat every year. If I can digress for a little bit, this really hit home many years ago with a case I saw for a second opinion. And this case really got me thinking about heartworm in cats, diagnosing and looking for it. And I'm in the Northeast. This cat came to me for a second opinion, and the goal was to get this cat spayed. We couldn't spay the cat because it kept coughing and having respiratory signs. The assumption at the time was we had an infection going on, and this cat had already been treated with many antibiotics. And like many cats, the cat responded to antibiotics, the symptoms went away, only to return when the antibiotics were stopped. So my recommendation was, let's stop treating, let's start diagnosing. And one of the diagnostic tests I chose was a heartworm antibody test, which surprisingly came back positive. It was surprising because the kitten was so young. The rest of the diagnostic tests, they came back normal and negative. So now we had something to work with. Now we had a path forward. And the treatment of this cat, well, you'll have to wait for the treatment section of this video. The third test is a radiograph or x-ray. If you look at a VD or DV radiograph, you might see a wide right and or left caudal lobal artery. The right is most commonly enlarged. You'll also see a bronchointerstitial pattern, otherwise known as extra white on an x-ray, due to all the body's inflammation in the lung in response to the heartworm. Less common radiographic changes might be hyperinflation of the lung and flattening of the diaphragm. And if those sound familiar, you probably have watched my asthma in cats video, since asthma can also cause many of these changes on a radiograph. And just like with asthma, seeing nothing on a radiograph can also occur in a heartworm positive cat. There can be some other changes on a radiograph. They are much less frequent, so I won't bore you with them here. And since heartworm is a lung disease in cats, you probably will see a normal looking heart. Quick quiz question. What are the only two tests that can definitively diagnose heartworm in cats? If you are skilled enough and lucky enough, an experienced ultrasonographer can see a heartworm and make a diagnosis of heartworm in real time with an ultrasound probe. This and a positive antigen test are the only definitive tests to diagnose heartworm in cats. Every other test that I've mentioned, if negative, lowers our heartworm suspicion, while if positive, raises our heartworm suspicion. One could argue there is a third test, seeing a microfilaria on a blood sample, but this is rarely done. Since our tests to look for and diagnose heartworm are not that great, one could argue the nationwide number is a bit low. The percentage of heartworm infected cats is probably much higher. It is definitely higher in the Southeast United States, Texas, and Mississippi River Valley. At the very minimum, we can draw some parallels from the heartworm dog maps that are out there. In any case, if heartworm affects a decent percentage of dogs in your area, consider it a possibility in a cat with a respiratory issue. If we have a heartworm positive cat, it is recommended to test every 6 months to monitor. It should be noted that heartworm antibody tests can remain positive for years, even when the antigen tests turn negative and symptoms have resolved. Treating heartworm in cats. We have a big old goose egg on this one. Treatments you would use in a dog are not recommended for a cat. There are a few cases where adult heartworms have been removed surgically, typically using an ultrasound probe, and as you can imagine, This procedure has some pretty big risks, including death, and is rarely done. So, in our heartworm-positive cats, we are typically reaching for medications for supportive care and to help control respiratory symptoms. We may reach for a steroid, which can help decrease inflammation in the lung and help resolve respiratory issues. We may reach for an antibiotic called doxycycline, which is a recommended treatment by the American Heartworm Society in dogs to address issues associated with Wolbachia, a bacteria that can be found in a heartworm larva, but its use is still being investigated in cats. So back to my case, I started with the antibiotic doxycycline. I was hoping maybe to clear the lungs of a Wolbachia infection. Doxycycline had not been used before, and for good reason. There can be a lot of side effects in a young animal. And just like with the other antibiotics, the respiratory symptoms resolved and returned as soon as doxycycline was stopped. The real reason why I chose doxycycline, I did not want to treat a young cat with steroids, which also have a fair number of side effects, especially in young cats. So I started treating with steroids, and within a few days, the respiratory symptoms went away. And in a few weeks, that cat was free of ovaries and a uterus. And that cat did great for years and years and years. I was never able to get that cat off of steroids. Every time we tried to lower the dose or get the cat off of steroids, the respiratory symptoms would return. The cat did so well for so many years. I did a dentistry on that cat just a few years ago, extracted a number of teeth. That cat did really well, sailed through the procedure, and continues to do well to this day. And speaking of clients in terms of giving heartworm prevention to their cats, they were, or rather are, my best clients in terms of heartworm prevention. They gave a heartworm prevention year-round, month after month, never missing a dose for years and years and years. And that brings us to our next section, heartworm prevention in cats. Since we do not have any treatment options and mosquitoes can find their way inside and affect our indoor-only cats, all we have is prevention. And unlike dogs, you do not have to test before starting a heartworm prevention in a cat. Again, the American Heartworm Society and CAP-C recommends every cat have heartworm prevention year-round. And the biggest reason why prevention fails to protect our cats against heartworm is compliance. Making sure one administers or applies a heartworm prevention as directed without missing a dose. There are many options to choose from. Choose whatever option you will be the most successful at administering consistently without any breaks. And the reasons why these organizations recommend year-round prevention: to increase compliance, to make up for a late or missed dose, and help controlling other common parasites, ones that can also affect us, with a comprehensive preventative, since many of the heartworm preventatives also protect against other parasites known to find their way inside our homes. One of the exciting things that can come from these recommendations, especially with testing, is much more data on heartworm in cats, which will help the cat population as a whole and help fine-tune our recommendations to you, the cat parent. And obviously, if your cat is not on heartworm prevention, well, you can't prevent it. All heartworm preventatives address the early larval stages after a mosquito bite. They do nothing for the adult heartworm, and that window can be as short as 51 days after a mosquito bite. If every dog was on a heartworm prevention, we wouldn't have a heartworm problem. And at least in dogs, we have a heartworm problem. And now we're starting to have a heartworm resistance problem. One factor to consider with heartworm prevention is the movement of animals, especially dogs. If a heartworm-positive dog moves to a location that is generally heartworm-free, that dog can set up heartworm in that area, which may account for known hotspots we have in this country. If a dog is going to be relocated to a new area for whatever reason, make sure that dog is tested and heartworm-free before doing so. And once they're in the new location, retest in 6 months. And just like with anything I say about dogs as a cat veterinarian, confirm what I said is true with a dog vet. Heartworm prevention is not really prevention because we're addressing the early larval stages already in a cat from becoming an adult heartworm. The infection is already there. What we are preventing is progression of the heartworm life cycle to the adult phase. Real prevention would be mosquito management, preventing a mosquito from biting a cat or dog. Easier said than done. And this type of prevention will really be geared more towards dogs because many mosquito repellents are not safe for use in cats. Having said that, there are some easy things one can do to help keep mosquito populations down, like avoiding standing water near the home or keeping cats inside, especially when mosquito populations are high outside. Most of what I do in my day is prevention, 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 and heartworm falls into that category. Cats can become infected with heartworm. We don't have any treatments, but we do have safe, effective preventatives. So, if you're not doing so already, strongly consider heartworm prevention in your cat and choose one that also protects against other parasites, and do so year-round. If you enjoyed this video, like, subscribe, and comment. Thanks so much for watching, and I will see you on my next video.